1989, with help from foreign aid workers and current leaders, Dr. Cynthia opened a makeshift clinic to look after people caught up in the armed conflict in Burma. Dr. Cynthia expected to return home to Burma in 3 months. 24 years later, she is still treating people at her Mae Tao Clinic on the Thai-Burma border. In 2012, Mae Tao Clinic looked after over 140,000 people from Burma, including migrant workers, refugees, villagers, and people displaced by armed conflict. In 2011, the Burma government introduced a number of reforms. Despite the reforms, many of the people coming to Mae Tao Clinic cannot access or afford health care in their own country. Burma has the lowest expenditure on health care in Southeast Asia. Despite Burma's government increasing spending on health care in 2013, the rise brought health care spending to a paltry 3.9% of the country's total budget. Burma is the only developing country in Southeast Asia where spending on the military is higher than combined spending on health care and education. In 1989, Dr. Cynthia's clinic might have started small, but today it has grown to resemble a small village. Its service now includes child health, reproductive health, primary eye care, dental, prosthetics, medical referral, adult and child outpatients, adult and child inpatients, trauma and emergency department.
People in Burma are still suffering from severe poverty and under threats of economic exploitation. Our clinic is not only treating refugees and migrants, but also from the city, from other side of Burma. Otherwise, they cannot access health services for life-threatening or life-saving care. In my lifetime, I have never seen the patient caseload at Mae Tao Clinic decrease, and it won't be until there are many years of stability and security exist in Burma. People of Burma and the civil society will never give up the love they have for their country and their children, and our clinic will never stop caring for these people, and we will work together with the community.
Dr. Cynthia says her ever-increasing patients' caseload is dedicated by poverty, military oppression, and the lack of human rights in Burma.
In the eastern Burma, the number of health statistics is shocking. 1 in 12 women in the eastern Burma community are at risk of death during pregnancy and childbirth. 1 in 5 children die before the age of 5, and many deaths are preventable, and 70% of deaths are caused by malaria, pneumonia, diarrhea that can be prevented by vaccine, water sanitation, and maternal nutrition.